While a mastectomy can help women defeat breast cancer, patients who have that surgery done also say goodbye to all of their breast tissue. And while implants are an option afterward, there's also a type of reconstructive surgery that uses the patient's own tissue. Mercy Hospital, Northwest Arkansas is the only hospital in the state where you can find it, but it can be hard to access because of the health insurance hurdles patients have to get through first.
Shannon Ellis survived breast cancer, but she says the mastectomy changed her body and she didn't fully feel like herself afterward.
I had made it through cancer and I was so grateful, but I was shocked every morning by my appearance. It has really meant everything to be restored.
Shannon, who lives in NWA, had what's called the DIEP flap surgery at Mercy Hospital, Northwest Arkansas, a little more than a year ago. After spending 5 years facing insurance denials and looking all over the country for a doctor who could do the surgery, it all came together for her at Mercy Hospital, Northwest Arkansas, after a surgeon who could do it took a job there.
Being able to do it here really meant everything, the difference between having it or not.
DIEP flap surgery takes tissue from the patient's abdomen area, which is then moved into the breast.
What I'm really excited about that we're being able to offer this surgery now locally, while before patients had to travel.
Dr. Kasha Kanya from Taylor Plastic Surgery says this procedure has been around since the 80s, but health insurance companies typically offer poor reimbursement rates that don't come close to what the surgery that can take up to 12 hours costs.
The reimbursement rate is so low. It's well below the market rate nationally.
Arkansas State Senator Joshua Bryant is working to fix that as he will sponsor a bill in the 2025 legislative session that would require insurance companies to cover what's been called the gold standard procedure for breast reconstruction.
In Arkansas, we always talk about access to care, getting the appropriate surgeons here and medical necessities here in our state, in our region, and then to say that we're just not going to provide that level of care, I think legislation is needed.
I just want it to be a choice for every woman on the table and paid for, should she choose to have it.
Shannon says her recovery from DIEP flap surgery has been great, and if she hadn't had it done in Arkansas, she would have had to travel down to New Orleans and pay out of pocket for it.